On today's opportunity for health accumulation, we're talking about how bone health is a direct reflection of our whole health and our likelihood of experiencing both quality and quantity of life. Listen, your bones, brittle bones, it is a big deal. In my experience, not too many people are walking around noticing other people's bone density, as a health parameter. In fact, the thing most people notice or talk about is people losing weight. Oh, I noticed you lost weight. Did you lose weight? Not, did your bone mass just decrease by 20% because you went on that crazy diet? Unfortunately, in this, process of weight loss, bone structure, it's part of it. And another reason why almost across the board, the last thing you want to do is lose weight. It doesn't mean you don't want to break down excess body fat, but losing tissue structure that holds your body up, also known as your bones, is a recipe for aging. And this aging, we can't feel it initially, but we are going to feel it if your bones are aging. As bones become more frail, our risk for minor health events start turning into life-altering health events. And that just increases markedly. That little fall, no big deal. Now it's a hip fracture. A little fall, no big deal. Now it's a wrist fracture. What is often overlooked with our bones is that they are actually a metabolically active tissue. They are continually remodeling, repairing, regenerating themselves. And this is happening over and over. The body is removing bone structure and building new bone structure. Right this very second, as you're sitting, as you're standing, as you're walking, this is happening. And this is all to maintain the integrity of our skeletal system. Because the bones, they're not a rock. They literally are a living tissue. They're alive. The cells are alive. And bones, they're not just keeping us upright, giving us good posture. Bones are secreting hormones. They're supporting metabolism. Just like your thyroid gland, your adrenal glands, your pituitary glands, your hypothalamus, like ovaries for women, testicles for men, they are an endocrine organ, your bones are. And the health of this organ has massive implications for metabolism, metabolic rate, for glucose tolerance, for insulin sensitivity, even for testosterone production. Your bones are in the health of them, manage this. One of the most studied ones is called osteocalcin, which is secreted by the bone forming cells called osteoblasts. And along with the actions I just mentioned, osteocalcin acts on fat cells to increase adiponectin production. And if you ever wanted to lose weight or been on a diet, adiponectin is a huge deal because adiponectin regulates how fatty acids and sugars are utilized. And it is a huge player in burning fat as an energy source. So low levels of adiponectin are associated with obesity, with type 2 diabetes, and atherosclerosis, which atherosclerosis is a big word for essentially aging blood vessels. It's plaque, it's weak vessels. And osteocalcin, from healthy bones, is a big player in signaling the production of adiponectin and supporting your capacity to use fat as an energy source and put glucose where it's supposed to go and sensitize your tissues to insulin. So once again, it is essential to focus on building strength, building stamina, building capableness, and increasing bodily function rather than losing weight. Losing weight is so 1980. Building capacity is now. So weight loss, without getting stronger, could literally be destroying your capacity for a quality and a quantity of life. Not to mention, maintaining the fat loss you did incur. Because if your bone is not healthy, that fat's coming back fast. And when patients get a DEXA scan, which says they're osteoporotic or they have osteopenia, the precursor to osteoporosis. They're often told, get on some calcium, 1,200 milligrams a day, make sure you have it in your diet. The problem is calcium will not solve this problem. It's not going to solve the bone loss problem. The problem is loss of adaptation when it comes to osteoporosis and osteopenia, related to a lack of asking the bones to grow and repair themselves. This is what physical exertion does for the bones. It enables them to adapt. It forces adaptation. It forces them to get stronger. Along with, the processed food that we're consuming, this whole process of processed food and sedentary lifestyle breaks bones down. It takes away the regenerative capacity. And in double time, when you are, in menopause, like a lady would be, post 50 kind of thing. So we got to watch the processed foods. Here are 5 quick steps to get your bones toned up that I've been putting together, that if you do, you're gonna have a tough time having brittle bones. So consider wearing a weight vest when you go for a walk. If you already have a walking routine going, that is. If you don't have a walking routine going, just start a walking routine. Number one exercise you can do for yourself is go for a walk. The balance, the movement, the bearing of your own weight against gravity, huge. Once you've got that brisk walk routine going, you got a few months in your belt, then consider adding the weight vest. Start with like 5 pounds, slowly increase the vest weight, and be sure that you're maintaining chest up posture while you're pulling your shoulders back, wearing the vest. We don't want your posture to get crazy because you got this weight on you. Secondly, you got to consider at least starting a regular strength training routine. This would be like going through, full range of motion movements like squats, like lunges, like push-ups, bench presses, pull-ups, pull-downs, rows, shoulder presses. Ideally, you would do these with free weights so that your body has to manage. That's like a dumbbell would be a free weight. Your body has to manage that weight the entire time you're doing the movement. And if you have injuries, it is important to work around them. Don't just throw in the towel. Don't say, gotta wait till I'm feeling good. No, work around them. If you have joint pains, figure out the greatest range of motion you can work through without causing pain during the movement or after the movement. Our joints, this is a side, but our joints should not hurt after physical exertion. Our joints should actually feel better because we just lube them up. We've lubricated them, and they should feel more capable than even before we went exercise. So this is a great barometer to measure whether or not your training routine is blessing your body. Do you feel invigorated? Do your joints feel good? Or do they feel like, whoa, I just did a lot of work? Next one, consume loads of colorful foods. More than consuming the high calcium foods, which it's fine, eat calcium, kefir, yogurt, go for it, raw milk. Consuming whole nutrient-dense foods is essential to supporting acid-base balance in the body and keeping the buffering agents, these minerals, in the bone instead of being sent out, leached from our bones because of the ultra-processed concentrated sugars and flours and vegetable oils that keep showing up in the food routine. It is paramount. Real food, subtracted, processed food. I would love to say you can get all your nutrients from food or from your own bacteria produced, your bacteria producing specific nutrients. But vitamin D, vitamin K2, I think pretty much supplemental are a must. K2 can and it historically was produced by our bacteria in our digestive tract. However, our lack of bacterial diversity in this industrialized, human seems to have really squelched this production. So it is really challenging to get enough sufficient amount of K2, unless you're, drinking gobs of raw milk, or you're, finding, trusted natto sources out there, fermented natto, to get your K2 from. So I think vitamin D, I think K2, one, they work very synergistically to signal optimal bone remodeling and remineralization, but I also think, a supplemental form is pretty much kind of needed for most everybody. Next, consider adding creatine before or after your strength training routine. Creatine, often we talk about it for its energy and muscle and like that kind of thing, but it also has studies showing that supplementing with creatine in tandem with the strength training. I wouldn't just take creatine, not strength training. Why do that? Why not get the benefits of both? But it increased femur bone bending strength, so like the likelihood of your femur snapping. Upper limb bone mineralization content went up, and lower limb total bone mass went up when these people were supplementing with creatine. So I think that's amazing, right? Creatine is very inexpensive, has so many values related to mental health and becoming more capable in life and building muscle more efficiently, energy, that it's a great option to consider. All right, so if you click below, you'll see that I have a great resource related to building bone, supporting bone, 10 keys I think are invaluable in the desire to stave off or get rid of osteoporosis, osteopenia, and enjoy a life where bones are healthy and vital, pumping out that osteocalcin, which is then pumping out that adiponectin, making it so much easier to maintain the body composition you want to make versus being in the weight loss cycle over and over again. All right, I'm Dr. Matt. Hope it's helpful. I'll see you guys and gals next time.